Did you know that stroke is one of the leading causes of death among the elderly? A stroke can occur suddenly, but our bodies always send warning signals. If detected in time, we can save ourselves or our loved ones. Let's join Health 999 in discovering the crucial warning signs of a stroke right now. 1. Numbness or weakness in the face, arms, or legs. One of the most obvious signs of a stroke is sudden numbness or weakness, especially on one side of the body. If you or a loved one suddenly cannot lift an arm or notice that one side of the face is drooping, call emergency services immediately. This numbness or weakness occurs due to an interruption in blood flow to the brain, preventing nerve cells from receiving enough oxygen and nutrients to function properly. When a part of the brain is affected, it loses its ability to control related muscles, causing weakness or loss of sensation on one side of the body. This can affect the face, arms, hands, or legs. Some people describe this sensation as tingling or pins and needles, while others may feel nothing at all in the affected area. Pay close attention to these unusual signs. If someone cannot lift their arm or keep it raised for a short time, it may be a warning sign of a stroke. A simple way to check is to ask them to raise both arms at the same time. If one arm drops or appears significantly weaker, they may be experiencing a stroke. Additionally, the loss of sensation may come with a loss of motor control. For example, a person may trip while trying to walk or struggle to grip objects as they normally would. This is particularly dangerous for older adults, as they are at higher risk of falling, which can result in serious injuries such as fractures or head trauma. Another important point is that numbness and weakness may not always occur suddenly but can develop gradually. Some people might feel slight weakness in their limbs in the morning and ignore the symptom. By the time the symptoms worsen, they may have missed the chance for early treatment. That is why any change in sensation or mobility should not be overlooked. If someone shows this symptom, do not wait to see if it will go away on its own. Call emergency services immediately because a stroke is a medical emergency. The sooner they receive treatment, the higher their chances of recovery and the lower the risk of severe complications. 2. Slurred speech or difficulty communicating. A person about to have a stroke may have trouble speaking or understanding others. They may slur their words, stutter, or even be unable to speak. A simple way to test this is to ask them to repeat a basic sentence. Communication difficulties can manifest in various ways. Some individuals suddenly stutter, producing unclear or broken speech. Others may mix up words or speak in sentences that do not make sense. This not only makes communication difficult, but can also cause fear and a sense of losing control. A simple test is to ask the person to repeat a short sentence, such as, "The weather is nice today." If they struggle to say it correctly or cannot repeat it at all, this may be a sign of a stroke. Furthermore, communication difficulties are not limited to speaking. Some stroke victims may also struggle to comprehend what others are saying. They may not respond to questions or may answer in a way that is unrelated to the conversation. This indicates damage to the brain areas responsible for language processing. When a stroke affects the part of the brain that controls speech and language, it can lead to aphasia, a condition that impairs speaking, understanding, reading, and writing. There are three main types of aphasia. Expressive aphasia. The person knows what they want to say but cannot form complete sentences. Receptive aphasia. The person can hear words but does not understand their meaning. Global aphasia. Both comprehension and speech are severely affected. Some patients may also exhibit dysarthria, a speech disorder caused by weak or impaired muscle control in the mouth and throat. This can result in slurred speech, changes in voice tone, or weak, barely audible sounds. If someone suddenly begins speaking unclearly or loses their ability to articulate words, seek medical help immediately. It is crucial not to ignore this warning sign. If an elderly person suddenly experiences difficulty speaking or understanding speech, call emergency services right away. The sooner a stroke is treated, the higher the chances of recovery. 3. Sudden vision loss. Sudden vision loss is a dangerous warning sign of a stroke, but it is often overlooked. Many people assume that blurry vision is just a sign of fatigue or aging, but in reality, it can be an emergency signal. When a stroke occurs, blood flow to the brain is interrupted. If the area responsible for processing vision is affected, the patient may experience partial or complete vision loss. This can occur in one eye or both and may last for a few seconds, minutes, or even permanently if not treated in time. Types of vision loss due to stroke. Hemianopia, partial vision loss. The patient can only see half of the visual field, making it difficult to read books, watch TV, or recognize faces. Cortical blindness, total blindness. In severe strokes, patients may lose their vision entirely. Diplopia, double vision. When the muscles controlling the eyes are affected, patients may see overlapping images. Amaurosis fugax, temporary vision loss. One eye may temporarily lose vision for a few minutes, as if a curtain is covering the sight. Why does a stroke cause vision loss? Our eyes function through a complex connection between the optic nerve and the visual cortex. When a stroke occurs, the blood carrying oxygen and nutrients cannot reach this area, damaging nerve cells. If the lack of blood flow persists, these cells die, leading to vision loss. Accompanying symptoms: sudden blurry vision, difficulty focusing on objects, dark spots covering part or all of the vision, increased sensitivity to light, causing discomfort, difficulty recognizing familiar faces or objects, loss of eye coordination, dizziness when looking around, severe headache along with vision loss. How to check for stroke-related vision loss. If you or a loved one suspect stroke-related vision loss, try these simple tests. Cover one eye and check for any missing areas in your field of vision. Move your eyes left to right, up and down, to see if any part of your vision is blurred or missing. Look in the mirror and observe if both eyes move synchronously. Ask someone nearby if they notice any abnormalities in your vision. If any of these symptoms appear, call emergency services immediately. What to do and how to prevent it. Call emergency services immediately. Stroke is a medical emergency, and time is critical for survival. Do not drive. If you experience sudden vision loss, ask someone to take you to the hospital. Monitor blood pressure and diabetes. These are major risk factors for stroke. Exercise regularly. Helps improve blood circulation and reduces artery blockages. Maintain a healthy diet. Avoid cholesterol-rich foods. Eat more vegetables and omega-3 to protect the nervous system and eyes. Manage stress and get enough sleep. Reduces the risk of high blood pressure and vascular problems. Remember, if you or a loved one experiences sudden vision loss, even for just a few seconds, seek emergency medical help immediately. A stroke does not wait, and time is the key to survival. 4. Dizziness, loss of balance, or difficulty walking. Stroke can cause severe dizziness, loss of balance, or an inability to walk properly. This is one of the symptoms that is often overlooked but is extremely important. Imagine you or a loved one suddenly feeling lightheaded, unable to stand steadily, or staggering as if intoxicated. This may not be a sign of aging but rather a dangerous warning signal of a stroke. Dizziness caused by a stroke usually appears suddenly and is accompanied by other symptoms such as severe headaches, nausea, or disorientation. The affected person may feel as if everything around them is spinning, or they may suddenly lose coordination of their limbs, making them prone to falling. If an elderly person experiences loss of balance or has difficulty controlling their steps for no apparent reason, this could be a sign of an impending stroke. Never take unusual dizziness lightly, especially if it is accompanied by other symptoms such as weakness, slurred speech, or vision loss. Another important point is that stroke-related dizziness can last longer than usual. Unlike dizziness caused by fatigue or low blood pressure, this symptom does not improve even when the person rests or drinks water. On the contrary, it may become more severe within minutes or hours. Many people might mistake dizziness and loss of balance for common conditions such as vestibular disorders or low blood pressure. However, there is a simple way to check whether this symptom is related to a stroke. If the person cannot walk normally, cannot touch their nose with their finger while their eyes are closed, or feels like they have lost control of their body, these are serious warning signs. So what should you do if you see a loved one suddenly experiencing dizziness and loss of balance? Immediately have them sit or lie down to prevent falls. Observe other symptoms and call emergency services if their condition does not improve. Time is a critical factor in saving a stroke victim, so do not wait. Additionally, research has shown that people with a history of high blood pressure, diabetes, or cardiovascular disease are at a higher risk of stroke. If you or a loved one falls into this high-risk group, pay special attention to any unusual signs. Remember, stroke does not only happen to the elderly, it can affect anyone. However, older adults are at a higher risk due to factors such as vascular aging, high blood pressure, and chronic health conditions. Therefore, never ignore any warning signs, even if they seem minor. 5. Severe headache without a clear cause. A sudden, severe headache with no apparent cause may be a warning sign of a stroke due to brain hemorrhage. Headaches are a common symptom and are often overlooked, but if a headache appears unusually intense and different from normal headaches, it requires special attention. Many elderly individuals may experience headaches due to various reasons such as stress, insomnia, high blood pressure, or other health issues. However, a stroke-related headache is different in intensity, duration, and accompanying sensations. Warning headaches of a stroke may have the following characteristics. Sudden onset with no prior warning. Extremely intense pain, possibly the worst headache the person has ever experienced. Accompanied by other symptoms such as nausea, vomiting, visual disturbances, or even loss of consciousness. Does not subside with regular painkillers. A sensation of dizziness or disorientation. When a headache is a sign of a stroke, it is often associated with brain hemorrhage, a dangerous form of stroke. Brain hemorrhage occurs when a blood vessel in the brain bursts, causing blood to leak out and exert pressure on surrounding brain tissue. This pressure can lead to severe damage and even death if not treated promptly. If you or a loved one experiences a severe headache along with any of the symptoms above, call emergency services immediately. Do not attempt to drive to the hospital, as the condition may worsen rapidly. Instead, call 911 or ask someone for assistance. It is important to remember that not all headaches indicate a stroke, but when a headache is unusually severe and sudden, always stay alert. Early recognition and swift action can save lives. How to quickly check for stroke. The F.A.S.T. rule. To quickly identify the risk of a stroke, remember the F.A.S.T. rule. F. Face. Ask the person to smile. Observe if one side of their face droops. If one side of the mouth is sagging or facial muscles appear asymmetrical, this could be a sign of a stroke. Arms. Ask them to raise both arms to shoulder level. If one arm is weak or cannot be lifted properly, it could indicate a stroke. Also, ask them to hold their arms up for a few seconds. If one arm gradually drifts downward, this is a concerning sign. Speech. Ask them to repeat a simple sentence, such as, "The weather is nice today." If they slur their words, speak unclearly, or are unable to speak, they may be experiencing a stroke. Pay attention to any unusual changes in their voice. Time. If you notice any of the above signs, do not hesitate. Call emergency services immediately. A stroke is a medical emergency, and every second matters. The sooner the treatment, the higher the chances of recovery. Additionally, remember that a stroke can occur even if these symptoms appear briefly. Never ignore any symptoms, even if they disappear within a few minutes. This could be a warning sign of a transient ischemic attack, TIA, which indicates a high risk of a major stroke. Conclusion. A stroke can occur suddenly, but by recognizing the early warning signs, we can save many lives. If you or a loved one experiences any of the symptoms mentioned above, do not hesitate. Call emergency services immediately. Share this video to help more people learn how to prevent strokes. Beyond recognizing the symptoms, you can also reduce the risk of stroke by maintaining a healthy lifestyle. Pay attention to your diet by limiting salt, sugar, and unhealthy fats. Eat plenty of leafy greens, fruits, and omega-3 rich foods to support cardiovascular health. Additionally, regular exercise, at least 30 minutes a day, helps improve blood circulation and lowers the risk of blocked arteries. Don't forget to schedule regular health checkups, especially if you have a history of high blood pressure, diabetes, or heart disease. High blood pressure is one of the leading causes of strokes, so managing it through a balanced diet and a healthy lifestyle is crucial. Finally, if you smoke, consider quitting today. Smoking significantly increases the risk of stroke. If you drink alcohol, do so in moderation, as excessive drinking can elevate blood pressure and lead to vascular problems. We can never predict when a stroke will happen, but we can take proactive steps to protect our health and that of our loved ones. Always remember the warning signs and apply preventive measures to live a healthier life. Thank you for watching. Don't forget to like, share, and subscribe to Health 999 for more valuable health information.